Hello, welcome back, and the purpose of this video is I've now had my colectomy in order to hopefully free me forever of diverticular disease, diverticulitis. That was last Friday, so I'm a week post-op now. So what I'm going to be doing in this video is just explaining what happened in the run-up to the operation, the sort of pre-op part, what happened directly afterwards, and what my experiences so far a week post-op have been. And hopefully the purpose of that is to impart to some of you who may be a bit nervous and worried about the situation, if you're possibly having to undergo it yourselves at some point in the future, some tips and advice that, you know, it's not all bad. So the brief history is September 2014 was when I first found out I had diverticular disease, when I got diverticulitis through a perforated diverticulum. I was in hospital for 8 days. Aggressive antibiotic therapy treatment. Didn't need surgery at the time, which was, you know, I was more than okay with. But as the months subsequently passed, I kept on getting recurrent bouts, flare-ups, etc. So I made the decision earlier on in the year to see if there was any way that I could do anything about it. I got an appointment with a colorectal surgeon, a great bloke. He's the one who actually ended up performing my surgery, and he sent me for a CT colonography, not a colonoscopy. Never had the camera all the way round. CT colonography, which said that, you know, things hadn't got any better and that he recommended a resection. So various bits and pieces took place, which I've explained in other videos, etc. I'm not going to go over them here. And eventually a date was set for the operation to take place, which was last Friday. So that would have been August the 12th at my local hospital. So in the run-up to the hospital, to the surgery, in the week prior to it, I had a meeting with, I was called into a meeting with one of the colorectal nurses who works with the surgeon's team, and given some things that I needed to do in the final run-up to Friday's operation date. Now they included, you have to bear with me, bending's a little bit sore. I've got some exhibits to show you. Okay, that included, for the 5 days prior to the operation, using this stuff, which I don't know if you can see what that is. That is a antibacterial sort of non-perfumed body wash, etc. So every day had to use that instead of soap or shower gel. Doesn't smell or anything like that, in order to just make sure that you know your skin is kept clean. I also had to take for 3 days 2 sort of energy drinks, 2 gloopy, thick sort of milkshake type things. They were a bit, I know they weren't disgusting, but the purpose of taking those was to give your body extra calories to enable you to heal quicker after surgery, because obviously you may not be able to eat as much once you've had the surgery, because you may not feel like it. And trust me, you don't. There was also some other carbohydrate drinks that I had to take as well prior to it. I was also given an injection to administer the night before, called Clexane, Clexane, which is an anti-blood clotting injection. So I took that. I mean, it was, they did say, oh, you can give that to yourself. I was like, oh, I'm not doing that. So I took it to my surgery, and the nurse did it. That was the night before. And the day before, I also had to start taking bowel preparation. Over here, I don't know what it's called elsewhere in the world. It's called Picolax, and it's like the world's laxative. It's great stuff, and the purpose of it is that your bowel clearly needs to be as empty as possible for any kind of bowel surgery. So I started taking that the day before. Once you started taking that, you can't eat anything solid. You can only have clear liquids. You can't have milk in your tea or coffee or anything like that. It's just got to be water or black tea or coffee. You can't have anything sort of fizzy, etc. But a trick with Picolax is, if you know that you've got to have it, then a couple of days before, start winding back on your sort of like intake of what you would normally eat, because it's going to come thundering out of your arsehole. I'm sorry, sorry about that, but everything's going to come out quickly the day before, once you've started taking the Picolax. So you might want to make things a little bit easier for yourselves by just cutting things back a little bit. It's not painful or anything, it's just inconvenient, and you find yourself going to the toilet a lot. So I was then had to report to the hospital the assessment, the operational assessments. I can't remember what it was bloody called. By 11:30 on the Friday morning. So I went there, got myself booked in, and this would probably be the only part of the entire procedure that I thought could be managed a bit better. In that, as soon as I was booked in, someone came through some double doors and was like, right, you, and all the other people that have been booked. Come on, off we go. And everyone's partners, or whoever had accompanied them, had to leave. Now, I thought that could have been managed a bit better, because I'd never had an operation before. I'd never had general anaesthetic before. I'd never been in that environment, and I was already a little bit worried. And my wife was with me, but she wasn't allowed to come through these double doors into this sort of pre-screening sort of thing where they get you all ready, etc. So she had to sort of leave, basically, and because we've got kids and stuff, she just came home, and there was no point in hanging around, really, was there? But anyway, sort of went through into this bit where I was sort of booked in, had my obs taken, blood pressure, temperature, height, weight, etc. And eventually a member of the anaesthetist's team came around, just asked me some questions about, have I ever responded poorly to an anaesthetic? Have I got any dental damage? Because sometimes, they need to know if you've got any false teeth or anything like that, because obviously you've got to fiddle around in your mouth getting tubes in and stuff. And they also want to know if you've got any like broken stuff or anything in there, which again you can understand. They don't want to go knocking stuff out, etc. But they did explain that sometimes dental damage can occur. So I then met with the anaesthetist, who came round, and she explained the anaesthetic procedure to me. And what she also explained was post-operative pain relief. And some of the issues some of the options that were available to her, which she wanted to discuss with me, was the use of an epidural, which is sort of catheter infused anaesthesia into your spinal area, which has to be administered while you're awake before the operation, so that afterwards it's all sort of ready to go. Or a spinal nerve blocker, which is kind of like a epidural, but not quite. It's nothing's left in there. Or sort of PCA, like patient-controlled analgesia, which is like a button that you could press, etc. So she wandered off and had a chat with the surgeon. She came back and she's like, right, okay, there's nothing, we're not going to do an epidural, because based on what the doctor said, the kind of surgery he needs to proceed with. So what we're going to do is we're going to go with the other sort of spinal issue. So I thought, okay, that's not a problem. And I have to say, every single member of staff, including the anaesthetist, that I met all the way through this procedure, was absolutely top notch. I can't fault them at all. But all the while you're sitting there, you're on your own, and you're looking around, and everyone's there. I was like, oh my God, if a door had opened and I could have got up and gone, I don't think I would have, but I would have seriously contemplated it. But anyway, you then go and get changed, you put your bag in a locker, and off you wander, eventually, when you're called. And I was led round by the anaesthetist to the anaesthetic room, and sort of sat down, and she explained to me what she was going to do, etc., and that it would involve me having to bend forward and injections being placed into my spine, which we then started to try and do. Now, just going on that point, it sounds horrendous, that does. Was it painful? No, it was not painful. Was it uncomfortable? Yeah, it was uncomfortable. There was a lot of pressure and a lot of pushing and a lot of poking. But she couldn't quite get the depth or whatever it was that she needed. So she decided, right, no, okay, we're going to go with the final option, which will be when you wake up, you have like the sort of pump thing. So I sort of laid back down. Now, never having had a general anaesthetic, I was always a bit sceptical about how quickly you sort of dropped off. So I laid down, and I thought there's got to be a part of you that fights it. It's got to take like a minute or something. And the bloke put a mask on me. He looked over my face. He goes, "Where are you going on your holidays today?" I was just about to answer, and the next thing I knew, I woke up in the in the recovery room. Nurse standing over me saying, "Yep, everything's gone fine. The only issue that's been is that the operation had to be converted from laparoscopic to open, which means that I have scars because of the where the lap ports were entered, and also a great big scar under my bikini line, if you like, where they sort of converted to open. The reason for that being was that there were several structures that they've got to make sure are safe whilst they're doing the operation, and they couldn't do that through a keyhole method. So he made the choice in the end, to go open. And then I was transferred onto the ward and for recovery. Now, as I said, I had PCA, patient-controlled analgesia, which was a sort of like little trigger on a pump connected to a drip, and every 5 minutes you could press the button and you could administer yourself a shot of I think it was morphine that was in it, and then every time you needed it, you did similar, etc. Now, I have to say that from waking up to today, pain-wise, from the actual incisions of the operation, I'm going to show you my belly now. I'm not sure how much you can see that. Now, the scar from the open part of the colectomy is under my belt line. I'm not going to show that. It's a bit painful, sort of bending down. And that big swelling is something else related to the operation, which I'll get onto in just a second. I've had very little pain or anything from the operation itself. The pain and discomfort I did experience came from, you are inflated with carbon dioxide. Now, that is a gas that the body that is soluble for the body, but obviously it doesn't dissipate instantly. And I found I had awful pains up here, etc. My first tip, which was actually a tip given to me on the ward, is make sure... Oh, excuse me, I keep forgetting to turn my notifications off on my phone. Make sure you got some like peppermint tea bags, etc., or infusions and stuff, and some mints to suck, because mint does help release trapped wind, of which there is going to be quite a bit. And I was also given other sort of regular painkillers, paracetamol, ibuprofen, and a couple of other little tablets. I can't remember what they were. But the first sort of day, sort of post-op, they try and encourage you to get back into your normal swing of things. Like, try and start eating, because you've got to get your sort of your stamina back up. You've got to get back to normal. You've got to get your gut working properly. Which for the first couple of days was a bit of an issue for me, until I'd started taking the peppermint tea, and they gave me peppermint oil as well to drink. And they got me up and about out of bed, sort of like sitting up and walking around fairly quickly. I mean, I was out sitting in a chair having a wash within 24 hours. And I was being encouraged to like walk to the toilet. Even though I had a catheter in my bladder, I was still encouraged, to walk around. A, because it helps free trap wind. And B, because you need to sort of keep moving about, because you don't want to be stuck in bed all day. So, excuse me. I got visited very soon from a physiotherapist who gave me some breathing techniques to undertake, which included sort of like taking deep breaths and also trying to cough quite a lot. Now, coughing is a thing that also is going to cause you one or two issues. The reason you need to cough is because they don't want any crap building up on your lungs, etc., so you don't get any other like chest infections or anything like that. So here, this thing was a godsend. It's just a rolled up towel. It's been taped up, and when you need to cough, you push this as firmly as you can against your incision, and you don't go hell for leather with your cough, but it helps because when you first cough, you feel like everything's going to try and jump out your body, and obviously things are sore, etc., down there. So you want to really sort of be careful of that. But that's the kind of thing that they need to sort of get you doing. I was then taken over the course of the next couple of days, encouraged to mobilise even more, and given a plan by the young girl. She was a lovely girl. They were all fantastic, all the stuff, to go for 4 60-metre walks a day. Doesn't sound much, but when you think about what your body's just been through, it's actually quite a lot, and it gives you a lot of confidence that you can get up and about reasonably sort of quickly, and you can start sort of the healing process. But also, moving about helps you with the trapped wind. And believe me, once the first fart comes out, it's... I mean, farts are good anyway. But the first one you're going to do post-operatively is going to reduce so much bloating. It's going to be unreal. Okay. So eventually catheters removed. I'm allowed to sort of sit up more. I'm encouraged to eat and drink. I mean, I'm shown how to get in and out of bed reasonably sort of pain-free wise. It's not going to be completely pain-free because you've got a great big cut across my abdomen. And then once the PCA was taken down, I was literally, all I had, that was me sort of like attachment free. I was then told I could go on to oral morphine, which I had to request. They weren't just going to give it to me. You had to sort of request it. And there had to be an hour's gap between each dosage. Because morphine's quite a sort of... although it's a good painkiller, it can have some side effects, and it's got some addictive qualities, and they don't particularly want people getting overly reliant on it or addicted to it. Now, here's another sort of trick that I'd learned from the previous time. If you are going into hospital for any kind of surgery and you are going to need some kind of pain relief, take some of these. These are a pair of like ankle socks, like gym socks. Make sure they're clean. You don't want to use your old ones out of your bag. And much the way you would with a newborn baby, you know, you get the scratch mitts when they're first born, stop them scratching their faces and stuff like that. Put them over your hands, because one of the side effects of morphine is it makes you itch. It doesn't make everyone itch, it made me itch. And you'll find that you, sort of more or less without knowing it, will, you know, you scratch yourself silly. And the scratches themselves can be quite uncomfortable. So, yeah, you might look a bit silly, but don't worry about it, okay? It just gives you something to, some confidence that everything's, that you're going to be able to sort of deal with it. Now, also, a pair of nail clippers. Make sure you cut your nails before you go, because that's going to be obviously a bit less painful. If you've got short nails, etc., you're not going to scratch yourself down to the bone. So that's that. I was then the colorectal surgeon. He met me each day that I was in there, and on the penultimate day decided he wanted to undertake a CT scan, because he wanted to be sure that the excuse me, I'm just going to have to wipe my face. It's quite a warm day here, so I'm just going to wipe my brow. He wanted to ensure that the join, the anastomosis, had taken properly. So I was sent down for a CT scan, and CT scan came back and it was fine. It looked really strong, it looked really good, but there was an issue identified, which I'm going to go back to my belly. Now you can see that looks quite swollen, which is understandable. But apparently that swelling is caused by what's called a rectus sheath hematoma, which is basically a bloody great big bruise around the muscles that would form your abs, your six-pack, if you had one on view. Excuse me. So, oh, excuse me. So I'm in the lap of the gods, really. That one will clear up whenever it clears up. There's not an awful lot that can be done about that. There's no sort of like magic pill, etc. I'm taking ibuprofen for the swelling. Hopefully that will work. But that was just a quick video, an update, sort of just letting you know that there isn't anything to be scared of. There's a lot to be worried about. There's a lot to be concerned about. Of course there is. But to be scared of, no. I've been through it, and I'm a bit of a wuss. I'm a bit of a, don't like that. But I've been through it fine. And it's a bit early to tell whether or not it's had any effect on my diverticular disease. But, here's hoping. I'll do an update in about a month just to go over how I'm feeling. Now, if you've got any questions, by all means, drop them in the comments box below the video, and I'll do my best to answer them as best I can. Now, questions is the key to this. Okay, don't be shy about asking questions. If you've got concerns and you've got worries, when you have meetings with your surgeons or your GPs or doctors or emergency rooms or accident emergencies, depending on what part of the world you're in. Oh, excuse me. They all do the same thing, basically. Then by all means ask them. Anyway, that's the end of this video. I hope you found it was informative. If you do have any questions for me, please let me know and I'll answer them as best I can. Anyway, take care. Thanks for watching and goodbye.